Today we'll cover practical prevention of common respiratory infections and acute gastroenteritis in the hospital setting, what spreads them, and the high-yield actions you can apply immediately on shift. Keep it simple: clean hands, correct mask use, clean surfaces, and safe let's not spread it habits. When we say respiratory infections, think of the common cluster that shows up in healthcare workers: upper respiratory tract infections, including rhinitis and acute tonsillopharyngitis, often viral, sometimes bacterial. Add influenza-like illnesses or systemic viral infections, fever, body aches, cough, especially during seasonal spikes. For the gastrointestinal side, we're focusing on acute gastroenteritis, typically sudden diarrhea and/or vomiting, often linked to contamination and hygiene gaps. Different symptoms, same principle: break the chain of transmission. Respiratory pathogens spread mainly through droplets and close contact, coughing, sneezing, even talking at close range. But here's the sneaky part: droplets land on hands and high-touch surfaces, bed rails, keyboards, charting areas, doorknobs. Then we do what humans do: we touch our face, adjust a mask, rub an eye, without realizing it. So prevention is not about a single perfect action, it's about reliable habits, repeated consistently. Gastroenteritis spreads through the fecal-oral route, meaning microscopic contamination from stool can reach another person's mouth. That sounds dramatic, but in real life it's simple. Contaminated hands after restroom use, contaminated surfaces, shared objects, then eating or touching the mouth. In a hospital, the prevention lever is the same as respiratory: hand hygiene, surface cleaning, and smart habits around food and personal items. If you do only one thing perfectly, make it hand hygiene. Use alcohol-based hand rub when hands are not visibly soiled. Cover all surfaces: palms, backs of hands, between fingers, thumbs, fingertips, and reminders around rings and nails. Rub until dry. Use soap and water when hands are visibly dirty after restroom use, and when you suspect contamination, lather thoroughly and rinse well. Your high-risk moments are predictable: before touching a patient, before clean or aseptic tasks, after body fluid exposure risk, after touching a patient, and after touching patient surroundings. Add GI-specific moments: after toilet use and before eating. This isn't about guilt, it's about building a routine that works even on busy shifts. For respiratory prevention, pair hand hygiene with correct mask use and respiratory etiquette. If you're coughing, sneezing, or symptomatic, mask early. Cover coughs and sneezes with tissue or the elbow. Dispose tissues properly, then clean hands immediately. Avoid repeatedly touching the front of the mask. If you adjust it, treat that as a hand hygiene moment. And remember, masks help most when used consistently, especially in close contact and crowded areas. PPE is protective only if it prevents self-contamination. Think in 2 steps. Put it on cleanly and take it off safely. After patient contact or contamination risk, remove gloves properly. Avoid touching your face and clean hands. If you're using personally owned washable PPE, treat it like clinical equipment. Store it properly and clean it appropriately. The goal is not more PPE. The goal is correct PPE with consistent hygiene. Now let's talk surfaces, because both respiratory and GI pathogens can hitchhike on objects. Focus on high-touch zones: door handles, bed rails, IV poles, call buttons, charting keyboards, phones, counters. A simple approach: identify your unit's top 10 high-touch surfaces and make cleaning predictable, either scheduled or clean after use for shared equipment. Pair this with hand hygiene so the chain breaks on both ends. One practical strategy is the buddy system. Pair up with a colleague to reinforce prevention habits. It's not policing, it's a quick, respectful checkpoint. Hand hygiene before you enter. Mask is slipping. Want a new one? Let's wipe the shared workstation. This works because it reduces decision fatigue. On hectic shifts, we don't rise to intentions, we fall to systems. The buddy system turns prevention into a team norm. Vaccination is a high-yield layer of protection, especially for respiratory infections. Hospital vaccination drives commonly focus on influenza and COVID-19, with pneumococcal vaccination for appropriate risk groups or policy-based coverage. If you've heard hesitations like, "I got sick after the vaccine," remember, post-vaccine symptoms can happen, but they're not the same as the disease. And the point is to reduce severe illness and transmission risk. Think of vaccination as part of the bundle. It doesn't replace hygiene or masking. It strengthens your baseline protection so your daily habits have a stronger effect. For acute gastroenteritis prevention, be extra strict with two things: hands and habits around eating. After restroom use, soap and water is your safest default. Before eating, clean hands, every time. Avoid bringing contaminated items, like phones used in patient areas, into eating spaces. If your setting faces sanitation challenges during certain seasons or after flooding, the basics matter even more. Safe water practices, clean surfaces, and early attention to any GI symptoms. The key is consistency. GI outbreaks often start from one missed step that repeats across people. You may hear about supplements like vitamin C or zinc for mild respiratory symptoms. Evidence can be mixed, and they should never replace core prevention. If used, think of them as optional and individualized, while keeping the real foundation: hand hygiene, masking when appropriate, cleaning, and vaccination. Let's close with a simple checklist you can remember on every shift. 1. Clean hands at the right moments. 2. Mask and respiratory etiquette when needed and avoid face touching. 3. Clean high-touch surfaces, especially shared stations and equipment. 4. Protect your eating space. Clean hands before eating and keep patient area items away. Apply these consistently and remind your buddy. Now proceed to the short assessment to confirm understanding.